I'm Dara Halpin and I'm the founder of Sheela. At Sheela, we're on a mission to empower you to take care of your pelvic floor health. This week's video is all about using proper names for parts of your body so you can communicate your pelvic floor symptoms accurately. If you visit a medical professional to get help with pelvic floor issues like incontinence, pain and prolapse, you'll be asked to describe your symptoms. This is pretty straightforward when it comes to how often you use the toilet, but it can be much more complex when you're asked to describe pain or other sensations. After all, how can you say it hurts if you don't know what it's called? Knowing the proper names for your anatomy gives you ownership of your body and allows you to be part of the discussion with your medical professionals about what might work for you and your unique circumstances. If you're in a position where surgical options are being discussed, knowing the proper names for your anatomy will be vital in assessing risks and understanding any side effects. It also really helps avoid confusion both when discussing your symptoms and receiving advice. If there is ever a point where you don't understand what a medical professional is telling you, ask. It's their job to help you understand. Appointments can be overwhelming, from overcoming your own anxieties about attending and answering awkward questions to receiving lots of new information quickly. You can always ask for a leaflet, article or website where you can get more information. Knowledge is power. So here is your anatomy lesson for the day. Genitals or genitalia. These are the external organs of reproduction that you can see on the outside of the body. For women, this is the vulva. The mons pubis, or pubic mound, is an area of soft tissue that covers the pubic bone. It's covered in pubic hair and helps protect the delicate tissues of the vulva. The clitoral hood is a fold of skin that surrounds and protects the glands of the clitoris. 90% of the clitoris is not visible on the outside. We can only see the glands, which is under the clitoral hood. The clitoris is extremely rich in nerve endings which are intertwined with the vagina, labia and urethra. Vulva is the term for all the visible parts of our sex organs, including the clitoral hood, the glands of the clitoris, the vagina vestibule and the labia. The labia majora, also known as outer lips, are a pair of skin folds that are totally unique to your body. Size, shape, colour and amount of hair all vary hugely between individuals. It's extremely unlikely that your labia will be symmetrical. There is no standard of normal for how the labia will look. The labia majora folds cover and protect the labia minora, clitoris and the vagina vestibule. The labia minora or inner lips are a pair of folds of smooth tissue which lie under the labia majora. These tissues also vary greatly from person to person. In an unstimulated condition, they cover the vaginal opening but become more open when you're aroused. The urethral opening is the end of your urethra where wee exits the body. It's a muscular structure that helps hold wee in and release it. It opens into the vaginal vestibule and sits just above the vaginal opening. The vaginal vestibule is the area between the labia minora and contains the clitoris, urethral opening and vaginal opening. The vaginal opening, or introitus, is the entrance to the vagina. It's where menstrual blood leaves the body, where a baby can exit the body, and can also be used for penetrative sex. The vagina is an internal muscular tube that runs from the vulva to the cervix, that's the entrance to the womb or uterus. It's incredibly stretchy and can facilitate penetrative sex, cervical smears and birthing a baby, among other things. When it's not being stretched, it returns to its normal size and the walls often rest against each other. The perineum is the area between the bottom of the vulva and the anus. This is the area we're sometimes told to massage in pregnancy to help prepare for birth. It's also the area that can be affected if you have a tear or an episiotomy while giving birth. The anus is the opening at the bottom of the rectum where poo exits the body. Our pelvic floor muscles are intimately intertwined with the function of our sex organs, both internally and externally, and with the bladder and the rectum. They start at our tailbone, just above the anus, and run underneath the pelvis, attaching to the pubic bone at the front. They encircle the rectum, vagina and urethra and help hold all of our pelvic organs like the bladder and the bowel in place. They form the foundation of our core and enable us to breathe. Having a basic knowledge of your anatomy and how it works will really help you find the solutions that work for you and improve your health outcomes quicker. It will also help you feel more confident in your medical appointments and your own personal research. That's it for this week. I really hope you enjoyed this video. If you did, please share it with anyone who you think might need it. Click subscribe to make sure you don't miss our next video with more practical hints and tips to help you take care of your pelvic floor. Thanks for watching.